Hello, everyone. Good evening. My name is Stephen Wang. I lead patient affairs at ViiV Healthcare in Asia, and it is my great pleasure to welcome you to today's Asia Pacific Committee event that we are hosting here at ViiV and GSK. For those of you who don't know ViiV Healthcare, we are a company that is solely devoted to HIV. Our mission is to leave no one living with HIV behind. We are particularly excited to host this event because we are really interested to hear from the communities on how we can essentially drive change with respect to health-related quality of life for people living with HIV. Today, we have an amazing panel for you on redefining quality of life, where we'll be reflecting on what we have seen at recent conferences and planning on how we can improve our future together in the new normal with HIV. COVID has had a huge effect around the world and in Asia. It has been described as a great disruptor, as it is something that the community has felt acutely. However, one unexpected outcome of the pandemic was the rapid innovation in HIV care at a pace that we have never seen before, from integrated care, long-term planning, and differentiated service delivery. This means that we are facing a moment where we can truly implement the real change that it takes from what we have learned and implemented during the pandemic, along with our past experiences to redefine quality of life for people living with HIV. Throughout today's session, we encourage everyone to engage with us on social media using hashtag #ChangingHIVCare in Asia. Next. The panel discussion for today will be recorded for the purpose of sharing on-demand access after the event. All community attendance will be anonymous. ViiV Healthcare has a responsibility to report any adverse events that are raised during today's session. Korean, Japanese, and Chinese interpretations are available. For those of you who will listen to the local language interpretation, please access the globe widget on your desktop and select the language. Next. Please note disclosure for today's event. Next. Here's a glimpse of our time today together. First, I'll give our esteemed panel an opportunity to introduce themselves. Then we'll have Professor Jeffrey Lazarus, who will be the first to reflect on what progress has been made in delivering health-related quality of life and how we can make it a part of the new normal. He will be speaking alongside with Dr. Stefan Koo, who will share his reflections on the importance of U equals U, undetectable equals untransmissible. Then we have our voice of the committee panel, including Brent, Jeff, Keita, and Ramil, who will be highlighting key things from the community, bringing together quality of life and lived experiences from the pandemic. We will take few question and answer after hearing the voice of the community. Finally, tonight will be an interactive session with polling activities. Please write any question you may have in the chat box and share it with everyone and engage with us in the poll. Now, without further ado, I would like to call on our esteemed panelists to introduce themselves, starting with Professor Jeffrey Lazarus.
Thank you very much, Tafen. My name is Jeff Lazarus. I'm a professor at the Barcelona Institute for Global Health and previously worked at the World Health Organization and the Global Fund to fight AIDS, tuberculosis, and malaria. I'm calling in today from New York, actually just a few blocks from where I used to live and attended the first ACT UP demonstrations for HIV rights over 30 years ago. Thank you.
Thank you. Dr. Koo?
Hello, everyone. I'm Dr. Stephen Koo from Taipei City Hospital, and I'm from Taiwan. It's my pleasure to join this amazing panel tonight. I'm an infectious disease specialist and working with the community for HIV treatment and prevention. Thank you.
Thank you, Professor Jeffrey and Dr. Koo. Next from the community panel, Brent Allen.
Hi, everyone. I'm joining from the Dajarung Lands, just north of Melbourne in Australia. I've had the great pleasure of representing people living with HIV for a number of years across the world in Canada, Australia, and I'm indebting this presentation and what we're doing tonight to people living with HIV. Thank you.
Jeff Kong.
Hello, everyone. I'm Jeff. I come from Beijing, China. My organization is Beijing Love Without. We provide service to 200 community organizations in technical support and your message transfer. Nice to meet you. 中国的朋友。
Thank you. And Keita?
Hi, everyone. I'm Keita from Tokyo, Japan. I'm working with a group called Jump Plus in Japan, and the group is working on the advocacy actions in Japan and also the networking between the people living with HIV. And it's a very exciting opportunity to talk with you, and I hope we get some interesting and good questions a lot. Thank you.
Thank you. And Ramil?
Hi, good afternoon. I'm Ramil Andak, SOGSC Rights Officer of APCOM. We are based in Bangkok, so I'm joining from Bangkok, but I'm originally from the Philippines. Bangkok is a regional organization working on health and rights of LGBTQI people and communities, MSM and transgender in the Asia Pacific region. We work in 33 countries, and we have partnerships in various countries in Asia Pacific. Good afternoon. Thank you for having us.
Wonderful. Thank you so much to our amazing faculty. We're excited to have with you all with us tonight. With me, I have my co-chair, Ben Young.
Hello, good evening, good afternoon, and good morning, everyone. I'm Ben Young, joining you from the very wee hours in the United States, and I am the head of the Global Medical Directors Group at ViiV Healthcare.
Thank you, Ben. And let's move on and progress to our objective for our time today. Our objective will include hearing findings from the recent conferences and opinions for our expert panel, and discuss key priorities and actions going forward to improve the health-related quality of life for people living with HIV. Our first poll question to the audience is, has HIV care got better or worse during the pandemic? And we will give everyone 15 seconds to answer this poll. So I can read it that we have 1/3 of people said the HIV care got better and 2/3 said it was worse. Next, we have another activities, and we want everyone to think about a word that would use to define quality of life for you. Please write your answer in the chat box. You can keep writing the word that means quality of life for you in the chat box. We'll have a consolidation later on. And let's move on and continue with our agenda today. So without further ado, I would like to have Professor Jeffrey Lazarus with our first topic on making health-related quality of life a part of the new normal. Over to you, Professor Lazarus.
Thank you very much, and thank you for the opportunity to say a few words about the new normal, which we hope will be a much better normal. And I like so much the title of today's event, Redefining Quality of Life, because that's what we really need to do as we start to emerge slowly from the pandemic, well aware that that's not the case in all countries. Next slide. So, one of the few positive outcomes, I think, of the pandemic is that the world now really does understand the importance of quality of life and of health-related quality of life. It's an issue that's been at the heart of the HIV agenda since the beginning, but it's only really begun to take traction in recent years. And I'm going to set out our vision from HIV outcomes, but also that was discussed at the AIDS conference and by many, many groups about what health-related quality of life can and should look like, particularly in the so-called post-pandemic period. So we know that the wider implications on health-related quality of life are at that intersection of COVID-19 and HIV. So it's interesting to hear that 1/3 of you voting found that HIV care has gotten better during the pandemic. It will be great in the discussion to hear more about that, because in general, the sentiment I've heard has been that it's gotten worse, and in some cases a lot worse, something that was also discussed at AIDS 2021, the virtual conference just a few months ago. And one of the ways we understand quality of life and health-related quality of life is by listening to people living with HIV. And we can do that through using measures like patient-reported outcomes, PROs, or sometimes referred to as PROMs. Next slide. So the three main issues I'd like to draw attention to, and that are priorities for the health system in order to reorient services to deliver care beyond viral suppression for people living with HIV, are multimorbidities, living with one or more comorbidities, the self-related HRQOL and the patient-reported outcomes that I just mentioned, and the persistent issue of stigma and discrimination, something I had hoped in 2021 would not be on our agenda, but I think, as everyone would agree, both stigma and institutionalized discrimination continue to be major issues for communities of people living with HIV. Next slide. So to reorient health systems, as a health systems professor, I'm looking at how the health systems around the world need to change to deliver better care, care that's more fit for purpose. We need to take a long-term approach. We need to be thinking about those comorbidities and now the many comorbidities as people living with HIV on effective antiretroviral therapy live much longer, and how to become more patient-centric. The focus needs to move from a focus on the virus to a focus on the person. That means we need to agree on what we mean by quality of life, how we can break down those healthcare silos, since we have to deal with a communicable disease and multiple non-communicable diseases, how we can develop accurate metrics. We're not measuring well many issues related to HIV. So in spite of all of the monitoring mechanisms from U and AIDS, WHO, at the national level, through the Global Fund, through PEPFAR and other organizations providing support, we still don't have a good measure, particularly for issues beyond viral suppression, and at all times to continue to meaningfully involve the population of people living with HIV. Next slide. So, to do this, we really need to think about how we can get policymakers, decision makers, administrators at all levels of the health system and in our governments to see the value of quality of life and what they'll often refer to as a resource-strained healthcare system, particularly here during the pandemic. But like I said at the beginning, we need to remind them that quality of life is something that everyone now knows is so important, yet people living with HIV will typically report lower quality of life. So we need to leverage the pandemic in order to make these gains and make sure that they're lasting gains. Next slide. So with that, I'm just going to pass over to Dr. Stefan. And again, thank you for the opportunity to just say a few words about the importance of addressing multimorbidity, health-related quality of life, and stigma and discrimination as we create a new normal where quality of life is at the center. Thank you.
Thank you, Professor Lazarus, for your insight. And we'll continue with Dr. Stefan Koo, who will address the importance of advocacy. Over to you, Dr. Koo.
Thank you, Taffy, and also thanks, Dr. Professor Lazarus, amazing talk. So after Professor's talk, I think we must wonder how and what if we start to measure the outcome of HIV treatment with the perspective of quality of life. So in the following 5 minutes, I'll present one study and talk about the recent progress of UAV in Taiwan. Next slide, please. So from April 2019 to January 2020, Dr. Oakley from the ViiV launched the web-based self-reported cross-sectional survey among people living with HIV called the Positive Perspectives Wave 2. So this is an international survey of people living with HIV aged 18 to 84 years and currently receiving ART. So it was designed to find out the participants' attitudes and behaviors and how HIV treatment impacted their health outcomes. So there are 60 questions in the survey, including several measurements to quantify quality of life, such as physical, mental, and sexual health, and their satisfaction with current treatment, for example. And the study recruited almost 2,400 participants in 25 countries. The top three countries were the United States, around 400 participants, South Africa, 179, and followed by Russia, 150. To be mentioned, there are several participants from Asia joining the survey as well. They are from Japan, Taiwan, China, and South Korea. Next slide. And one of the most important measures of this study is whether the participants have been exposed to U equals U information. I think most of us here should have heard of U equals U, undetectable equals untransmittable, meaning people living with HIV receiving suppressive ART with an undetectable viral load can't pass HIV to their seronegative partners via condomless sex. So this is really important, not only because it's one of the most groundbreaking scientific finding from the HPTN 052, partner 2, and opposite attract studies, and endorsed by many international organizations. But also it sends a very positive and transformative message, showing people living with HIV, they are not disease vectors, and they can be touched and loved like anyone else. Next slides. So we're jumping to the part of awareness of U equals U and how it's associated with health outcomes. So in the study, the participants were categorized into 3 groups. Group A, those who had never heard of U equals U. Group B, those have discussed with U equals U with their healthcare providers. And Group C, those heard about U equals U only from sources other than their healthcare providers. And the results were pretty straightforward and interesting. So overall, there are 2/3 of the participants reported ever discussing U equals U with their healthcare providers. And the prevalence were lowest among heterosexual men and people living with HIV in Asia, so around 50%. And also that means 1/3 of people living with HIV in this study didn't have any discussion with their healthcare providers about U equals U. And compared with those who are aware of U equals U, those who had discussion with their healthcare provider had significantly lower chance of suboptimal adherence and higher chance of self-reported viral suppression, optimal overall mental and sexual health, and report they always share their HIV status. So in conclusion, people living with HIV who had discussion of U equals U with their healthcare provider had better health outcomes. Next. So I think it's really time that we healthcare providers should discuss with our patients about U equals U as a standard of care. And also I think these latest scientific evidence of U equals U should be taken into consideration when in countries where people still persecuted for HIV transmission. For example, in Taiwan, we had a special law called Article 21, and it's a law that makes it a crime for people living with HIV to have unsafe sex or condomless oral, anal, or vaginal sex by definition if they didn't disclose their HIV status. And this law applies to whether, regardless of whether HIV is in fact transmitted or not. And the sentence range from 5 to 12 years imprisonment. So as of December 31st, 2019, around 20 persecution were reported. So this article looks very awful and punitive and outdated, but it's still very hard to abolish this law. So the NGOs, the Medical Association, Taiwan CDC have worked together to change the definition of unsafe sex. And actually we added the idea of U equals U to the amendment, which took effect just 2 months ago. So it's not perfect, but it's a important initiative to decriminalize HIV transmission in Taiwan and improve our community's quality of life using this idea of U equals U. Thank you.
Thank you very much, Dr. Q, for sharing this insight. And I really love the sentiment around U equals U is transformative for people living with HIV, affirming people as a whole being worthy of love and affection and not vectors for disease. Thank you so much. Next, please continue to submit your question in the chat box. We will assign them to one of our panelists after the Voice of the Community sections. And if you are joining us now, please engage with us online with the hashtag Changing HIV Care in Asia. Now, I'm extremely delighted to hand over to my co-chair, Ben, to lead the Voice of the Community section. Over to you, Ben.
Well, thank you, Ta-Fan, and thank you, doctors and professor, for your really concise and on-point presentations. I'm super excited, particularly as one of the many Asian diaspora, to be joining you today. As I said earlier, I'm joining you from the wee hours in the morning in the United States. But really to focus this on the community, I'm really pleased to be moderating the session on voices from the community. And so I'm very excited, as always, to be kicking this session off with a world-renowned, dedicated HIV activist, phenomenal speaker from Australia, Brent Allen. Brent.
I'm so delighted to join all of you. This is such an important discussion for us to have. And I think one of the things I want to talk about to begin with is about how we position quality of life as people living with HIV. You know, we have, and we talk about often, the 3 90s, 90, 90, 90, 90% of people getting tested who are HIV positive, 90% of people on treatment, and 90% of people who have an undetectable viral load. And I would like to suggest to everyone that one of the things that underpins the 3 90s is what is the 4th 90. And, you know, you'll have to forgive me. I speak with my hands a lot. So it's kind of like this, right? You got the 90, 90, 90, and then you have the 4th 90, and it's supporting all of the other 3 90s. I think that's an important way to envision when we talk about quality of life. The second thing I really want to talk about is that we have been using this tool in Australia, and Jeffrey spoke about, you know, using tools that on the metrics to measure quality of life called POSQUAL. It's 13 questions, 4 different domains: health, psychological, social, and functional domains. Super easy to use. It's been translated into lots of different languages around the world. For all of my colleagues living with HIV who are working in the community sector, I really encourage you to look at it as a tool that you can use to advance your understandings in your own countries in a way that doesn't encumber clinicians or anyone else. Next slide, please. Over the last 9 months, if we could have the next slide, that'd be fantastic. We've been doing this thing in Australia about listening to people with HIV and trying to understand what is it that affects their quality of life in both a negative and positive way. So in this diagram, what we're trying to describe here is that the person living with HIV is in the center. And you'll see what's called the degrees of influence, both positive and negative. And what we've been discovering so far is that having a supportive social structure around you, having friends, having people who are also HIV positive that you can talk to, having intimate networks of people are 2 of the most important things that positively contribute to a person's quality of life living with HIV. Further afield, things like having a great clinician, making sure that there's less side effects and that the drugs are easy for you to take, having an older age, having a sense of religiosity or spirituality in your life, and having a higher level of education also are positive contributing factors. No surprise, stigma, the biggest thing that is negatively affecting people who are living with HIV and their quality of life. It is one of the things we hear again and again. Further to that, isolation, loneliness, feeling like there's no one around you, having a poor mental health situation, either anxiety, depression, or something more profound. And this is something that's super interesting, I find, around one of the negative influences are things like poverty, home life insecurity, having your visa or migration status challenged. These are all things that I think are negatively influencing quality of life. Over the next few months in Australia, we're going to be hopefully talking to as many people as we can living with HIV and agencies supporting them to further refine this diagram and get a greater sense of what it's really like. And what we're hoping to do come World AIDS Day is we're going to publish what we're calling the Australian Accord on Quality of Life for people living with HIV. What we want and what we're trying to do by doing this process is saying that this is coming from people living with HIV. These are the issues that are coming from us, from our lives. Of course, they are informed by science and evidence and research. But what we're gathering in Australia at the moment is what people on the ground are saying to us. I am so delighted to share this with you. I think it's really important to further articulate what's going on in our lives, especially during COVID-19, where loneliness and isolation are two of the things that we hadn't really, I think, thought of in many ways before and how they're affecting our lives. Thanks. I'm going to pass on now to our next presenter.
Thanks, Brent, as always. So next, I'd like to invite Mr. Jeff Kong, a community advocate. We'll be playing a pre-recorded video from Jeff.
Hello, I'm Jeff Kong. I come from UXU China as Community Network. During the COVID-19 outbreak in China, in addition to the closure of communities and cities, the HIV specialized hospital where people living with HIV get their daily medications became hospital specialized in COVID-19 care. Whenever an outbreak occurs in a particular area, such hospitals are closed. Doctors and community organizations work together to mail medicines to the people living with HIV. For areas that do not have a courier service, it can take a long time to get the package. Those who have been receiving treatment for 3 to 10 years, they thought they could live in peace without worrying about medications. The outbreak of COVID-19 has disrupted everything, and the people living with HIV are refocusing on the problem of getting drugs. About the new normal, there is an increasing awareness among people living with HIV about accumulating their medicine, maintaining some drug reserve. Some people have changed their designated hospital, where they collect their medicine to a hospital closer to home, because the hospital where they are now collecting their medicine is close to home. Their concerns about privacy, disclosure of their HIV status are growing. The first-line drugs are still 3 separate pill regimens in China, and many people living with HIV want the government to offer 1 single pill tablet as a free first-line drug. This could help doctors reduce error in dispensing drugs to patients. People living with HIV also want to reduce the number of visits to the hospitals. In the future, with the advent of long-acting drugs, they would not have to take drugs every day. Doctors in China have very little knowledge of the science behind UXU messaging, and we want the government and the CDC to pay more attention to the promotion of UXU message. Thank you.
Thank you so much. Next, we'd like to be joined by Mr. Keita, a community advocate. Keita, over to you.
Thank you very much. I would like to share my thoughts on how we can maintain our quality of life with HIV or something uncertain and cannot control fully. A key is the process we understand something uncertain with scientific knowledge. As you may know, COVID pandemic started 2 years ago, and everybody got affected with this, no matter who has HIV or doesn't have it. I think all of us had a difficult time in this period on how to stay safe and keep our life going. Living and facing something uncertain is always a big challenge, and especially when its scale is huge. To get out of uncertainty and bring our life back under our control, scientific knowledge and development are the keys to enable this. Thanks to healthcare providers and scientists working very hard to find and developing the treatment for COVID-19 and prevention to the virus, the situation is much better now. But I want to discuss one thing. So I want to share a question here. Is scientific knowledge enough to get out of this uncertainty? I think the answer is no. As even we share scientific knowledge based on good evidence, and we carefully share what we can say from the evidence. Some or a lot of people do not take actions as we suggest. I'm not here to blame or criticize them, as I myself can be seen as that kind of person at some time. If I find knowledge is skeptical and not enough to take some actions because the knowledge is not, I think, not reliable enough. So we all have our own process and speed to understand knowledge or get the knowledge and reflect that knowledge into actions. So I will share a story on how a person understood the meaning of living with HIV these days here. I was diagnosed as HIV positive in 2011, and at that time, I only knew HIV is not dying disease, and people can live their life with it. But I could not hardly believe it. And I thought I was dying and cannot have my normal life back and cannot finish my degree and need to hide in my room. The image was something like that. And I got to know I will be okay even with HIV when I first met a person living with HIV for more than 10 years at that time. He proudly told me that he was living with HIV more than 10 years in the very first peer meeting I attended. And in the meeting, I learned a lot on how to live with HIV in everyday life and what it is like today in general, meaning, and what I really need to care for when we see some symptom and so on. So I think my experience is not a real story, and a lot of people here today have similar experience or know some story like this. The scientific knowledge and input from healthcare provider is in clinic are not always effective enough to understand HIV or something new and uncertain. I would like to mention, however, discourse on or general communication on HIV around our community has the power to support people understand them. So our community, those who living with HIV and those who trying to work on or support on the related issues, succeeded on customizing, bringing and reflecting most advanced scientific knowledge into action plan or advocacies and tell people what it means to us. make discourse around it, and support people to understand them in deeper level. So HIV is yet an ongoing issue, and we are getting a lot of new findings even today. And to minimize uncertainty on HIV and get over with the virus, the problem with HIV altogether, it's important to keep update ourselves and tackle together. Also, this process, bringing new scientific knowledge to society and support people to understand it, it is not only valuable process that we have, but it's also useful or valuable actions that we can do something for COVID. That's my thought. Thank you.
Thank you so much, Keita, for your reflections on how we can do better with our communication and support for people with HIV. Clearly, they're challenging times, and COVID has not been helpful. Next, we'd like to be joined by Ms. Ramil Amdag as SOGI SC officer. Ramil, over to you.
Thank you very much, and good afternoon again. And thank you for having us here to share reflections on redefining the quality of life in the new normal. I will be speaking from the experience of APCOM as a regional organization working on LGBTQI health and rights, MSM, and transgender in Asia and the Pacific. And this is my reflections will be based on the experience of APCOM and in our conversations and activities with our country partners. So how did one of the shifts due to the disruptions by COVID-19 is the expansion of the discussions actually on health to include mental health and well-being. And we think that this is a very, very important expansion when we're talking about quality of life. But also due to the disruptions of COVID-19, there were also reflections on the normative contents when we're talking on the right to health. COVID-19 has affected the accessibility of HIV and other health services. In context where even before COVID, there have been issues and challenges in accessing services, both geographically and economically. How did COVID-19 affect the availability of health services? Also in the context that even before COVID, there have been challenges in availability, quality of services. These have been challenged by COVID-19. And also that COVID-19 we also saw the important role of community organizations in service delivery. Community organizations have been instrumental in ensuring that services for marginalized communities continue even during COVID-19. And community organizations have been successful in addressing these challenges. Because community organization, we know the communities, and as such, we have the capacity and we are in the position to deliver services to the sector which we work with, sectors which are most marginalized and discriminated. Another major reflection is that there really is no one size fits all in terms of response. Response has to be contextualized. COVID-19 has highlighted and exacerbated inequalities, especially for people and communities who have been experiencing marginalization and discrimination even prior to the pandemic. As responses, and because responses have primarily been framed heteronormatively. So those who do not fit that frame would fall off the margins and become invisible. This invisibility can come in programming and data, and this contributes to people and sectors continuing to be experiencing being left behind. At the start of the pandemic, there was not much data on the effects of COVID-19 on key populations and LGBTQI communities. Community organizations were instrumental in providing this data. For example, in our experience in APCO, we did surveys on the effects of COVID-19 on partner communities and organizations. And that survey showed that COVID-19 affected access to services not only related to HIV and health services, but in relation also to employment, in relation to relationships with family, effects on mental health and well-being of people of diverse OGSC, and effects on the operations of organizations who have been delivering health services. Another reflection for APCOM is, and this has been, and we are continuously navigating this, how do we continue services, including awareness raising, advocacy, by maximizing the available online platforms, because this has been highlighted also by COVID-19. How do we leverage online platforms for the things that we do, and ensuring connectivity with our partner organizations, because this is very important in terms of service delivery. In terms of reflecting on the new normal, air quotes, what does it mean for the communities? We go back to the human rights principles of equality and non-discrimination, meaningful participation and inclusion, as these are cornerstones, I think, to that collective goal of leaving no one behind. And we see that no one left behind should be in terms of responses, services, programs, and policies. What is responses, services, programs, and policies should be inclusive. We should pay more attention to those who are being left behind, are experiencing discrimination and marginalization. How do we build back by being more inclusive? How do we ensure that there are platforms for meaningful participation? And that in the process of building back, inclusion should be reflected in all phases of programming, planning, implementation, evaluation. How do we support organization and community-led networks? Because, as I said, and as has been highlighted also by COVID-19, community-led networks and organizations have been in the forefront in reaching the most discriminated and marginalized communities. In the new normal, how do we frame our responses on the principles of equality and non-discrimination, meaningful participation, inclusion? Thank you very much.
Thank you so much, Ramil, for a really inspiring and detailed analysis of the things that about community-led responses and what your organization has done through the pandemic, and with suggestions for others. Let's go back to Dr. Stefan to hear about one tangible action that we can implement in the new normal. Stefan, back to you.
Thank you. So first, I would like to echo the audience and other panelists. And people mention a lot about stigma and discrimination affecting people living with HIV, which gets even worse during COVID pandemic. Like in Taiwan, people are facing double stigma while they're disclosing their HIV and the COVID status during the contact tracing, for example. And second, I think as a HIV doctor in Asia, my colleagues are kind of reluctant to talk about U equals U, for example, and other quality of life issues with our clients and patients with community or outside the community. So I think we should really talk proactive about it. Like on the very first day when people had their diagnosis of HIV infection, or when they started treatment, or on the day they have their first time undetected viral load, people should celebrate it, and we should talk about UXU with them. And even when they have date somebody or they started a relationship, it's also a great time to talk about it. So make U equals U a cliche, a new normal for doing the HIV daily practice. So when the public and our patient become very used to it, I think HIV will no longer be seen as a deadly threat to everybody. So we can probably bring down the stigma. Thank you.
Thank you, Dr. Stefan. Again, wonderful thoughts, and thank you to you and to all of our community panelists. Next, we will transition to our question and answer section. Again, I think that your insights really give us a lot of information about your knowledge and reflections from across the Asia region. The question, though, that I would like to pose to our participants is on the next slide, and this reflects to how does quality of life, or U equals U, contribute to ending the goal of ending AIDS. And so which policy actions will make the biggest impact to the quality of life of people living with HIV? I'm going to say, does the panel have any particular advice on this? Let me first start with Dr. Stefan, and then let's go over to Brent, if you will.
Yeah, I think, for example, like we are doing this decriminalization action in our country. I think it's a very meaningful because it's not a right law as we can see, and of course in a lot of countries in the world we're still having this kind of law. So it's really affecting the human rights. So for us, I think in terms of policy, this is a very the government, the scientists, the doctors like us, and also the NGOs should all stand together and to have these like a very firm stance using scientific evidence to change the law. I think it's really about time to really implement it, and we can all learn from each other, especially from other countries who have made great progress.
No, thanks, Dr. Stefan. I think, in particular, the notion of stigma and what we can do about it as health providers is particularly important. And I'm aware, as someone noted in the chat, that in some settings and in some providers, the health interaction itself is stigmatizing. I think it's noteworthy to signpost that here. Again, over to you, Brent.
Look, I think just to carry on from Stefan's fantastic comments is the notion of the protective quality of social connectedness. And if that means just a few people around you, if that means getting online and finding a social forum where you feel connected, if it means going to a barbecue that the local HIV organization hosts, I think we should never diminish what the power of social connections mean in people's life and how profound they are around quality of life. I guess my take-home message is, if you are challenged by HIV stigma and discrimination, then build that social connectedness around you, that circle of support.
Thanks, Brent. Just a quick follow-up then. In terms of quality of life, can you expand on how this, how is quality of life interfacing with aging in Australia? Clearly, in the Asia Pacific region, aging is a phenomenon that's happening, particularly with or among people with HIV. So, is there any particular learnings that you might be able to share?
Look, I think everyone who's living with HIV wonders and worries, is anxious about aging with HIV. What are the longer-term effects of antiretroviral therapies and the rest of the things we have to do to manage our lives pharmacologically? I think, though, that there is resilience that builds over time with people who are aging with HIV, have had HIV for a considerable period of time, and are becoming resilient, about being older, getting older, feeling like they are in control in a kind of intellectual and an emotional kind of way. It's one of the areas I would love to tease out a little bit more getting older in many cultures is not a positive thing, unfortunately. And in many Asian cultures, it's great. It's actually celebrated. But I think it is a conundrum at the moment.
As always, thanks, Brent. Let's move on to our last interaction. Again, this is a question about for our participants about policy. And so, which policy actions do you think will make the biggest impact on quality of life for people with HIV? We've pre-populated some answers for you to choose from, and please select one answer. The answers are, number one, better monitoring of comorbidities at the healthcare system level. Number two, develop a consensus on a metric for measuring quality of life. Number three, ensure HCPs, healthcare professionals, and people with HIV are made aware of U equals U. Number four, educate other professionals, teachers, law enforcement, for example, to reduce stigma. Number five, increase equity in healthcare for people with HIV. And number six, develop a wider variety of ways to access HIV testing to ensure early diagnosis. So there's a quite wide range of results. The leading answer was to educate other professionals in ways to reduce stigma, followed closely by measures of quality of life and U equals U. Thank you all for participating in that poll. As we wrap up today's session, I'd like to give an opportunity for a couple of our panelists who have some closing statements and reflections on today's conversation to share. So at first, I'd like to pass back to Ramil.
Thank you very much. I would go back to my earlier statement. How do we reflect on the new normal by framing everything that we do around the basic principles of equality and non-discrimination, inclusion, meaningful participation? And how do we frame these programs and actions which we will do, not only from the binary perspective, but by becoming more inclusive? Because a lot will fall off from this if we do not take into consideration the diversity. And these are basic human rights principles. And how do we ensure that communities are front and center of these responses? How do we support communities in these responses? And I guess also we should look into intersectionality, because this has been coming out, I think, even earlier with health and other measures, for example, employment, access to other services, because these things, and other issues like aging, because these things would have a lot of impact when we're discussing quality of life. And I think this would also contribute to breaking the silos. Thank you very much again from APCOM.
Thank you, Ramil. And Professor Jeff, your last thoughts?
Thank you very much, Ben, and everyone, especially the community discussion. For me, and I know this sounds a little boring, but I do think monitoring is a central issue, because it keeps government, it allows us to advocate to governments, and it covers really all of these issues. I mean, if we're not, I saw the poll result, if we're not doing a good job of educating teachers, educating peers, healthcare providers, then we're going to see worse outcomes, and we'll capture those outcomes through monitoring frameworks. And like I said in my opening remarks, I think the current monitoring has gotten a lot better with the new U and AIDS strategy, but it's still not fit for purpose. And I saw in the poll there was a question or an option for a metric that would maybe bring together issues around stigma, health-related quality of life, comorbidities. I think that could be very useful. You know, what Brent referred to as the fourth 90 that I contributed to, but really it's just making sure that the monitoring is fit for purpose, and then making sure that the community has a voice in that monitoring to contribute to it or to reflect on it, to make sure that governments are doing the right job in presenting the situation, so we can continue to improve it. Thank you.
Thank you, Jeff, for your pearls today, but also for being such a seminal leader in the notion of bringing quality of life to the way we think about the public health and individual response to HIV. We're very, very appreciative of all of that. We're running short on time, and so I would like to just share, to offer a huge thanks to all of our community panelists and speakers who shared both their work and their personal experiences today, and really on the important aspect of how to improve the health-related quality of life for people with HIV. And perhaps equally as important, I'd like to thank our audience for spending some time with us today, investing your time in our community of listeners on social media as well. Thank you everyone for engaging with us today. As a reminder, today's session is recorded and will be made available for online and on-demand access. There will be a survey at the end, which we'd ask you to complete. And so again, once again, I'd like to thank all of you, our panelists, for engaging us with the Asia Pacific Community event on redefining quality of life in this new normal. On behalf of my colleagues at GSK and ViiV and Ta-Fen Wang, thank you. My name is Ben Young. It has been a pleasure in hosting and sharing this space with you today. Until next time, please be safe and have a wonderful remainder of the week.
Thank you. Bye-bye. Thank you so much.